Good morning. We're here conducting an interview of Dr. Cyrus Haddadi. He is the Associate Director of Cardiac Arrhythmia Research in the Department of Cardiac Electrophysiology at the MedStar Washington Hospital Center. We're here to discuss COVID-19 and its effects on the cardiac rhythm. Take it away, Dr. Haddadi.
Kelly, thank you so much for your time. I'm really thrilled and flattered to be here speaking with you today. And I think we've discovered over the past 2 years in the setting of this pandemic that COVID-19, the disease caused by the novel SARS-CoV-2 coronavirus, absolutely can affect the heart. And it can actually affect the heart in subtle but also profound ways. Directly, we know that heart tissue, myocardium, contains the angiotensin receptor, and the coronavirus can attach to this receptor to enter myocardium and damage it directly. In the background, COVID-19 is an incredibly pro-inflammatory disease, and this setting of intense systemic inflammation can also affect the endothelial cells that form the lining of our heart and blood vessels. We've also recently discovered that COVID-19 affects the vagus nerve. This is one of the major nerves in the body that runs from the brain directly to the heart, lungs, and intestines. It's responsible for balancing and modulating heart rates and blood pressures. And so if you have damage to your vagus nerve, which long-haul COVID-19 survivors do seem to have, you can have difficulties with appropriate heart rate and blood pressure responses to really very minor stimuli, like getting up from sitting down or going for a short walk. You have to distinguish a little bit from what we saw at the height of the pandemic versus what we see now when more people are vaccinated and boosted. And you might not think that a heart rhythm specialist would see a lot of COVID-19 patients, but actually when hospitals were full with unvaccinated patients, when hospitals were full with very sick patients who had systemic COVID-19, we saw many consults right here at MedStar Washington Hospital Center and in our sister satellite hospitals. In the sickest of the sick patients, COVID-19 could cause absolutely dreadful heart rhythm complications, from sudden cardiac death due to dangerous, deadly ventricular tachyarrhythmias like VT or ventricular fibrillation, due to inflammation, systemic critical illness, or to things like pacemaker dependence. We speculate that the inflammation from the coronavirus caused damage to the natural conduction system of the heart. And we had patients who needed both temporary and permanent pacemakers. Now that more and more individuals are vaccinated and boosted, we've shifted away from the acute phase of COVID-19 heart rhythm to more of a chronic phase where we're seeing more and more people come in with POTS-like conditions. POTS, or postural orthostatic tachycardia syndrome, is a poorly understood condition, but it seems to be linked to preceding viral illnesses. POTS, like a disturbance of the vagus nerve, can cause disruptions in the body's ability to balance out heart rates and blood pressures. And so individuals who are often very young, in their 20s and 30s, will notice tachycardia, palpitations, racing heartbeats, dizziness, lightheadedness, brain fog, with even the most minor of exercise or stimulation. And this really has proven to be very challenging for the patients themselves, but also for us as physicians and nurses to be able to bring them back to their best health and their prior good quality of life. When we first started seeing patients who experienced irregular heart rhythms due to COVID-19, many of these patients were so sick that we couldn't make an effective intervention. So if you had an irregular heart rhythm and that was allowed to persist for weeks and weeks, you could get what we call a tachycardia-induced cardiomyopathy. Basically, the heart had worn itself out from beating so fast. Even after you're able to treat that, to return the heart rhythm to normal, some of these individuals did not have full recovery of their heart function. So they developed congestive heart failure. Now, that was during the worst of the pandemic. And again, I think you have to make a distinction between acute COVID-19 heart rhythm disturbances before widespread vaccination and now. When I see patients now in my office who have tachycardia, racing heartbeats, I can often give them a lot of assurance that this is due to transient inflammation in their heart. And with some patients, sometimes up to 6 or 12 months, the inflammation will resolve and the tachycardia and palpitations will go away.
Do you find that the medications and treatments that you use for heart rhythm anomalies respond in the same way to COVID-19 induced heart rhythm anomalies, or is there a difference in how the medications react in each of those conditions?
I think goal-directed medical therapy with the use of beta blockers and ACE inhibitors has been well established to help a weakened heart regain its strength. For patients who specifically are experiencing acute inflammation causing irregular heart rhythms or heart block disorders, we sometimes will use steroids to try to reduce that inflammation. So we had many good outcomes when patients who seemed to require a pacemaker received steroids, inflammation of the cardiac conduction system improved, and then electrical recovery meant that they didn't need a pacemaker after all. Here at MedStar, we have a very robust program for COVID-19 recovery, and we have an active registry of patients that we share with the COVID-19 recovery program, looking at their outcomes over time. And I think that we found for many of these patients, who again are often very young, in their 20s, 30s, 40s, who have POTS-like symptoms after COVID, we see recovery with a long enough wait. To be honest with you, I think it's about 50-50. I do think that men are sometimes resistant to coming in and getting medical care. So in the hospital for consults, it was an even split. In my office, it tends to be slightly more women, and I do think it is because men are resistant to medical care. Most of the patients who come in with POTS-like syndromes are young. And I think a part of that is when the vaccinations first came out, they were age stratified. So I remember my father qualified first, then my mother, who was a little bit younger, and then the rest of the population. So I think there was a period of time where younger people were not as protected as they are now. I think they're about the same. By the time that we experienced the Omicron surge, which was very heavy back in January, the majority of patients had been vaccinated, and so their experiences with Omicron were relatively milder. That said, I've met patients who said, I just had the sniffles, I tested positive for COVID-19, but now I have palpitations every day. So I think there's a little bit of some variability in what your initial COVID presentation is versus the degree of inflammation that may then develop over the next 6, 8, 12 weeks inside your body. I really do think that as a division here in cardiac electrophysiology, we are so thrilled to be called or consulted with any kinds of questions or comments about heart rhythm in patients. I think if there is any tiny silver lining to this awful pandemic, it's that POTS, which has existed for years as a very poorly understood condition linked to preceding viral illnesses, may now finally get the attention and research that it demands. And so I think we may be on the verge of really investigating this condition better and coming up with some real solutions. And so I'm excited to see what the future holds for recovery for patients who've experienced COVID but have ongoing symptoms.